In this short video, we're going to look at coding guidelines for Chapter 4 of CM, 1C4A1 and 1C4A2. So this first coding guideline here talks about the type of diabetes, and it says, the age of a patient is not the sole determining factor, though most type 1 diabetics develop the condition before reaching puberty. For this reason, type 1 diabetes mellitus is also referred to as juvenile diabetes. Okay, so if we have a scenario where it's a 10-year-old female patient who's been experiencing excessive thirst, fatigue, and weight loss, and the physician determines that her symptoms can be attributed to juvenile diabetes, we code that with the main term, diabetes. And then if you look for juvenile type, juvenile onset, it tells you to see diabetes type 1. So if you remember that, you can just go straight to diabetes type 1. And in this case, we're going to use this default code here, E10.9. Notice also in this scenario that the patient is experiencing some symptoms that would be integral to this condition. So we're not going to code the excessive thirst, fatigue, and weight loss. These are covered with the definitive diagnosis of E10.9. Coding Guideline 1C4A2 tells us what to do if the type of diabetes is not documented. It says if the type of diabetes mellitus is not documented in the medical record, the default is E11, type 2 diabetes mellitus. So let's take a look at a scenario here that relates to this coding guideline. This is a 69-year-old patient. She's admitted because her diabetes is out of control. She also has diabetic neuralgia. So this patient, their documentation says that they have diabetes, but it doesn't say whether it's type 1 or 2. So according to the guideline, we will code it as a type 2. But it is also out of control. So one thing we can do is do diabetes and then out of control. And it tells us to code diabetes by type with hyperglycemia. So now we want to do diabetes type 2 with hyperglycemia. And we get E1165. We check it out in the tabular, and it is a complete code, and that is the correct code for this situation. She also has diabetic neuralgia, so we're going to need another code to cover that. So we know she has diabetes type 2, so we can just do diabetes type 2 with neuralgia, and we'll get E1142. You could have also just done diabetes with neuralgia, and you're going to get the same code because the classification defaults diabetes without a specified type to the diabetes type 2 codes. So either way, you're good. E1142 is our second code.